project in Selby Town Primary Care Network is around developing a population health management approach across our locality, and there's two key strands to that. One is around improving the health of a certain group of our practice population, and the second bit has been around developing partnership working with colleagues across the Selby district.
As a PCN, we'd always identified frailty as a sort of key priority area. And what the data showed us was that when you went from people who were sort of mild to moderately frail, who then slipped into a category of severe frailty, the cost to the system when they sort of progressed up from mild and moderate frailty into severe frailty was huge. We ended up narrowing it down by hypertension.
By identifying what is currently available, then we can make sure we are producing some services and support that is more accessible and open to the actual patients. So we're making sure that it's suitable for the patients and we can adapt to make sure that they feel fully involved in their health. So we made the initial contact with the cohort. We introduced ourselves, we explained what the questionnaires were about, and therefore we collected the data, and we've also coded the information into individual records as well.
There was a lot of good joint working between different organisations, and that wasn't just within the PCN, it was also with the local council and lots of voluntary organisations as well. This particularly helped with structuring the questionnaire.
People's lives are lived out there in the community. It's not, you don't come to a GP until you have an issue. So it's about what are the kind of things in your life that impact on your health that we can make changes. So you maybe never have to go to a GP. We wanted to learn principles of how to engage those people in better health and lifestyle management.
The cohort was chosen, the 50 to 64 year age group that had hypertension and mild to moderate frailty. So we know about the health issues there, but what's preventing them from accessing support?
Previously, we would just focus on very narrow practice-based registered lists. Now we're beginning to think about our population need in a completely different way in terms of anticipating need, not necessarily for the people who come to see us, although that's still important, but the people who don't come to see us, and how can we address their need before they develop a crisis or a problem that needs our help.
I think we've enjoyed and learned that it's really nice to have the opportunity to reach out to patients, so it's a much more proactive way of working.
One bit of feedback we had from the patients themselves was that they enjoyed that we contacted them rather than them having to ring the GP for anything. So we found it was quite a proactive process rather than the usual reactive involvement that we would have with patients.
Nobody said, I want more tablets, or I want to see my doctor more. What they wanted, and what turns out is much more important to them, are connections, social connections, activities, I guess a sense of belonging.
One of the things that has been really interesting is working across the different organisations, and you think you all understand what health is and you think you're all talking the same language, but you really aren't. It brought us into a bit more of a common language. So taking the time to understand each other a bit more has really opened the door as to what we think we can achieve.
We got to know each other as people, as well as addressing some of these quite challenging issues, and it felt like a really collaborative, creative space. And the logic model that we used, it was really impressive how quickly people start to put together ideas and throw things in.
As a team, we spend our day engaging with patients, and we were quite unsure how people would react to the project, and we really didn't think there'd be much interest. But when we made the initial consent calls, that completely changed. It was so well received that it really motivated us, and it made us really enjoy our involvement.
Broad ranging solutions, from vouchers for a local fruit and veg shop, activity activities for people to do. I think it gave people a real sense of, and for me this was a really important thing, is it's not all about a clinical intervention, it's about a community intervention.
Got a lot of support around primary care and secondary care data. What we perhaps were missing was that broader picture around need outside of the health sector.
It's been a really eye-opening experience, and one that I think is going to be so important for us going forwards as general practice begins to think about what our purpose is in a completely new way.
Doing some intelligence-led work to reach out to just a small cohort of people is giving us all enough understanding to think how we can work with that wider group. The programme allows you just to take a step back, use the strength of your partners. You need to want to commit, and you need to put some time aside, but it's a little bit of pain for a lot of gain.